All right, today we're tackling a fascinating condition called apraxia. So I want you to imagine for a second that your brain is this master architect, right? It's got the perfect blueprint for every single move you make. But what happens if there's a glitch in that plan?
Okay, picture this. You know exactly how to wave goodbye. You totally get the request, your arm muscles are working just fine. But when you actually go to do it, the message just gets scrambled. The command doesn't go through. And that, right there, is the central puzzle of apraxia.
So what is apraxia, officially? Well, it's a motor disorder where someone loses the ability to perform these learned, purposeful movements. Now, the key thing to get here, and this is super important, it's not about muscle weakness or paralysis. The muscles are fine. It's a breakdown in motor planning. The brain knows the goal, but it just can't map out the steps to get there.
So, to really get a handle on this, here's how we're going to break it down. First, we'll explore that disconnect between the mind and the body. Then, we'll dive into all the different ways apraxia can show up. After that, we'll connect it all back to what's happening in the brain, and we'll wrap up with how it's diagnosed and managed.
Okay, let's jump right in. Section 1, a glitch in the action. We're going to really try to understand this disconnect.
You know, one of the trickiest things about apraxia is that it can sound a lot like other conditions, but it's really not the same. For instance, it's not ataxia. That's a coordination problem, kind of like being clumsy. And it's not aphasia, which is about language. Apraxia is totally unique. It's a disruption of the brain's plan for an action.
And this leads to one of the most bizarre and frankly fascinating features of apraxia. It's called automatic voluntary dissociation. So what does that even mean? It means a person might be completely unable to pick up a phone if you ask them to. It's a command and nothing. But if that same phone suddenly rings, they might just grab it automatically without even thinking. The automatic circuit is working, but that voluntary on-command circuit, it's down.
So it turns out this glitch isn't just a single one-size-fits-all problem. Not at all. Apraxia can show up in a whole bunch of different ways, affecting very specific abilities. And that brings us right to our second section, the many types of apraxia.
Okay, first up, we have something called ideational apraxia. This is where the breakdown happens with the concept of the task itself. So someone with this might know all the individual steps to make toast, but they get the sequence all wrong. Like they might try to butter the bread before it even goes in the toaster. Or they might grab the wrong tool for the job, like trying to comb their hair with a toothbrush. The whole idea, the what of the action, is just muddled.
Then we have ideomotor apraxia. Now this is different. Here, the person can perfectly explain the task, they get the idea, no problem. But they can't actually perform it when you ask them to. The motor program just won't run on command. So if you say, hey, pretend to brush your teeth, they might really struggle even though they know exactly what that involves.
So let's put those two side by side to make it crystal clear. Ideational apraxia, that's a problem with the concept. Think using a screwdriver as a pen. The idea is wrong. Ideomotor apraxia, that's a problem with performing on command. Think knowing how to wave, but not being able to do it when someone asks. So it's concept versus execution.
And believe me, the list goes on, which just shows how specific this condition can be. There's bucofacial apraxia, which is actually the most common type, and that affects facial movements, like trying to wink or whistle. You've got limb kinetic apraxia, making those really precise movements like tying your shoes or typing super difficult. Then there's constructional apraxia, which messes with your ability to draw or copy simple shapes. And a big one, apraxia of speech, where the brain can't plan the movements for talking, so a word like potato might come out jumbled, like tatapa.
Wow. So with all these different ways it can show up, you've got to wonder, where exactly in the brain is this glitch happening? And that's the perfect lead into our third section, where we'll connect these symptoms right back to their source.
So where does apraxia actually come from? Well, it's most often caused by damage, a lesion, in the brain's dominant hemisphere. For most people, that's the left side. And more specifically, the damage is usually in the frontal and parietal lobes. You can think of these as the brain's headquarters for planning and then executing movements.
And what causes that damage in the first place? Well, we're talking about acquired apraxia, meaning it's something that develops later in life. And the usual suspects are things like a stroke, a traumatic brain injury, a brain tumor, or other neurodegenerative disorders, things you've heard of like Alzheimer's or Parkinson's disease. Okay, so we know what it is, the different flavors it comes in, and where it stems from in the brain. But how do doctors actually identify and then manage a condition that's this complex? Let's get into our final section, diagnosis and management.
Now, here's something that's really interesting about diagnosing apraxia. Those formal, standardized tests you do in a clinic, they don't always tell the whole story. Remember that whole automatic voluntary thing we talked about? Someone might totally fail a test where they're asked, "Show me how you use a hammer." But then they go home to their workshop and can use one perfectly fine without thinking about it. And because of that, a really comprehensive assessment is absolutely crucial. It's not just one thing. It includes that formal testing, sure, like something called the Tulia for upper limb apraxia, but it also involves just observing the person during their daily routines, measuring how they handle everyday activities, what they call ADLs, and of course talking to both the patients and their families to get the complete picture.
So when it comes to management, the whole approach is rehabilitative. It's all about therapies that can help retrain the brain's motor planning. We're talking about things like occupational therapy to help with daily tasks, physical therapy, speech therapy, and even something called gesture therapy, which uses cues to help rebuild those broken action pathways.
And this is a really important point to make. Right now, there are no medications indicated for apraxia. The entire focus of treatment is on therapy and helping people develop new strategies for navigating daily life.
So, if there's one thing you take away from all this, let it be this. Apraxia is not about weakness, and it's not about confusion. It is a breakdown in the brain's plan for movement. It's that glitch in the blueprint that sits right between knowing what to do and actually being able to do it. And that really leaves us with a final thought to chew on. Think about it. From picking up your coffee cup to typing out an email, just how many thousands of incredibly complex motor plans does our brain execute flawlessly, automatically, every single day, without us ever even noticing? It's pretty amazing when you stop to think about it.